Today we're joined by Dr. Jason Robert Guertin, researcher at the CHU de Québec Research Centre and associate professor in the Department of Preventative and Social Medicine at the Université Laval. His work focuses on the economic evaluation of health technologies, ways to improve current methods, and the impact of rare and chronic conditions on a patient's quality of life and their healthcare costs. Hi, Jason. Welcome to the show.
Thank you.
So many people don't understand the complex process it takes for a drug to go from initial discovery in the lab to making its way to the shelves of their local pharmacy. One important step in that process is called health technology assessment. Could you define first what health technology is, and then explain health technology assessment and why it's so important to bringing new drugs to the public?
Health technology is basically the umbrella term for drugs, interventions, changes in the system that are trying to help the healthcare system. So it's really that umbrella term. But the HTA process specifically is more, let's put it in the context of drugs. So when we have a new drug that comes to market, we have payers that are trying to decide, should we reimburse it or not? So the HTA committee basically will have clinicians, economic experts, legal ethicists to see, is it a right or a bad choice to say yes to this reimbursement? So what we try to do is every people on the committee will give their input on, is this good or not? Mm-hmm. And at the end of the day, we're trying to get a consensus, not necessarily everyone on board, but trying at the end of the day that we have an overall majority that's going to recommend to the payers, whether they be private or public, should we reimburse this drug or not?
So now that we understand a little bit about health technology assessment, I'd like to focus on another important role, and that's the role of the health economist, you. So could you tell us what a health economist does and why your work is so important to improving the healthcare system and bringing new treatments to patients, especially when it comes to the accessibility and affordability of drugs?
Well, like I said, some economists do work on the HTA process, and our role is really trying to see, so how much does it cost to actually acquire the treatment, but also care for the disease, how much patients pay out of pocket. So that is the cost analysis piece. The second piece is what we call budget impact analysis. So if we say yes for a technology, the question is, how much is it going to change the budget? So our job is to project over a couple of years, how much would we increase or decrease spending in some circumstances? And lastly, very recently, my field has started to look at environmental impacts. So trying to say, well, we look at money being a finite resource, but everything on earth is a finite resource. So our field is really trying to grasp, so what are the environmental consequences, hopefully savings, if we adopt some technologies over it.
Excellent. Okay, so it's clear that a health economist really plays a huge role in making sure the healthcare system remains cost effective. Shifting focus a little bit, I'd like to narrow down on regenerative medicines in particular, which hold great promise to treat a lot of diseases, some of which we've heard about in previous episodes. From your perspective, what are the main economic challenges or barriers to making these therapies more widely available?
Well, one of the biggest issues is we unfortunately know very little about how much spending is actually done in the healthcare system across the nation. So especially in cases where we're looking at rare diseases, low volume populations, often more than not what we will see in regards to regenerative medicine. So a lot of what we need to do is actually focus on getting those input, getting that data. And that's also part of where my work comes into play, and trying to help researchers plan out these circumstances to see, well, if we adopt your technology, what will it cost over the next couple of years, especially considering what we currently have as a comparator.
Okay. So the healthcare system is constantly evolving with the rise of new technologies and more personalized medicines. How do you see health economics evolving in the future, especially as it relates to health innovations?
I guess right now my field is a little bit the odd man out in the regenerative medicine space. So we're often there at the end of the road trying to see, so we finally have something that works. We want to get it reimbursed, and the health economics part is really that last piece and trying, okay, so this is how much it costs, this is how much you would save, how much we would benefit as a society in effectiveness. Is it cost effectiveness? Yes or no? But in the future years, well, my hope at least, is that we actually get involved much earlier on in the process to say, how do we track costs when you're doing trials? How do we track costs for patients and for society, that later on, once you actually have a treatment that works, that we are already ready to do the economic piece.
Right. Excellent. Thank you so much. This has been really great learning a little bit about health economics, and we look forward to following the progress of your research. Thank you very much.
Thank you.
To our viewers at home, you can find more episodes of Stem Cells from the Sofa on our YouTube channel. Thanks for tuning in.